everyone. Today's question is, which prostaglandin agents can be used to maintain the patency of Ductus Arteriosus in neonates with congenital heart problems while awaiting the surgery? Options are option A misoprostol, B epoprostinol, C bimatoprost and D alprostadil. What is Ductus Arteriosus? That is a fetal blood vessel that connects the aorta and pulmonary artery, which is to be closed after the birth when the baby starts to respire through the lungs. So what happens if this blood vessel is not shut? The oxygenated blood from the aorta flows back to the pulmonary artery, causing the recirculation through the lungs. And this in turn leads to the increase in the volume of blood flow through the pulmonary circulation. Such a congenital heart defect is known as patent ductus arteriosus. Now, let's come back to our question. The prostaglandin agent that is used to maintain the patency of the ductus arteriosus in neonates. Options are option A misoprostol. That is a prostaglandin E1 analog used for the gastrointestinal protection and to induce the labor. Option B epoprostinol. Epoprostinol, that is a prostaglandin I2 analog. It is indicated for pulmonary arterial hypertension. Option C bimatoprost. It is a prostaglandin F2 alpha analog. It is administered topically in the eye to treat the open angle glaucoma. Option D alprostadil. What is alprostadil? It is also a prostaglandin E1 analog. It is having the vasodilation property and it acts on the ductus arteriosus to keep this blood vessel open and it maintains a normal blood flow. So the answer for our question in this particular condition is option D alprostadil. Thank you.